let's say even if maybe your spouse comes up behind you, you're doing dishes and puts you in a bear hug and, they're thinking, hey, I'm ready. And you're like, oh my gosh, I've got the dishes. I have to wipe down the countertops. I'm cleaning up this. There's no room for that responsive desire. And so with libido, we want to be looking at so many things, right? That integrative, multidisciplinary approach.
Welcome to Mother Nature's Doctor, the podcast where ancient wisdom meets modern wellness. Hosted by Dr. April Schulte, a specialist in Chinese medicine, this show explores the power of nature as the ultimate healer. Each week, Dr. Schulte dives into a new health topic, revealing how holistic practices, herbal medicine, and time-tested natural remedies can help you live a healthier, more balanced life. Get ready to nourish your body, calm your mind, and reconnect with the wisdom of Mother Nature.
Hello and welcome to the Mother Nature's Doctor podcast. I am so happy to have you all join us for this extra special podcast today. My name is Dr. April Schulte. I am the founder of Mother Nature's Doctor. And with me today, I am honored to have a very good friend of mine who I've known professionally now for at least 20 years. I am so happy to have with me today Amy Hill Fife, who is a well-respected pelvic health physical therapist with over 25 years of experience. She specializes in treating women's pelvic health issues, including those related to sexual trauma, and holds board certifications as a women's certified specialist and certified sex counselor. Amy has been recognized for her contributions to pelvic health, notably receiving the Culture of Change Award from the Office of Women's Health for her work with female veterans. She focuses on trauma-informed care, advocating for better training for pelvic health professionals. Her commitment to education and awareness in the field aims to improve the quality of care for women facing pelvic health challenges. Amy, thank you so much for joining me for this edition of Mother Nature's Doctor podcast. I am very interested in hearing from you about your current passions because having been an expert in the field for now 25 years, I imagine you have some of the passions that are kind of newer to you these days.
Absolutely. Oh my gosh, Dr. April, thank you so much for having me. I feel honored to be on your program, and I am so grateful that I have known you for 20 years. Personally and also professionally. So thank you so much. Yes, 25 years. It's hard to believe that I've been doing this for that long. And it's amazing how things have developed and fallen into place. As you mentioned, I have more and more of a focus in trauma-informed care and working with women specifically. I also work with men, but more so with women who have had trauma in their lives, specifically sexual trauma.
I've noticed in my 21 years of practice too that we cannot separate our physical health from our emotional health. And it is especially prominent when we talk about pelvic health. And as someone who specializes in women's health, I've noticed, a lot of women have sexual trauma. And it doesn't have to be sexual in nature, but sexual trauma certainly seems to be a primary thing that I see in my practice. Do you see sexual trauma in men as well, affecting the pelvic floor and pelvic health for men?
Absolutely. In fact, more research is coming out that ties in IBS or irritable bowel syndrome, and that's in men more so, but it also happens in women. And they also have research now that constipation is directly related to sexual trauma in women as well as men. So the better research is showing us how these things are related. And I know we'll get into this a little bit more about how that works physiologically in our bodies.
I'm not surprised at all to hear that constipation and other bowel issues, are deeply impacted by trauma, because when we have that trauma response, from a Chinese medicine perspective, we would say that that causes the qi or the body's energy to become real stuck. And before maybe we get into that too far, maybe describe just real briefly, what is the pelvic floor? What is included in the pelvic area, just anatomically?
Yes. So we all sort of just forget about our pelvic region. In fact, the nerve that goes to the pelvic floor muscles and gives us a sensation in our pelvic area, pudenda, the Latin root, and someone may fact check me on this, but I believe the Latin root means shame. So we're already sort of set up for this shameful part of our body. And so that's one of the reasons no one really talks about it. However, if you think of your pelvis, right now, if you're sitting down listening to this, we're sitting on our sits bones, which is part of our pelvis, or we talk about our hip bones when we touch the top of like that crest, by our abdomen. And so inside that, you have everyone, men and women, have 24 pelvic floor muscles, and they are situated in 3 layers. So we have a deep layer, we have a middle layer, and we have more of an external layer of muscles. So there's 24 muscles there, and I don't really know anywhere in the body where we have 24 muscles all situated together. Maybe in the face is the only thing I'm thinking, or the throat.
I mean, we are complex beings, but what's really interesting, if you bring up the throat and the face, and I think about TMJ, or we call it TMD, temporal, the mandibular joint disorder,
Yep.
that when we hold tension there, that, it's sort of obvious we can't really open our mouth, or we have jaw problems or mouth problems. But we also hold that tension in the pelvic floor. So
Yes.
interesting, brought up that as an analogy of how many muscles it takes to sort of support that area.
Right. And sometimes I will tell people, hey, you actually may not need to do Kegels. Kegels are actually pelvic floor muscle exercises. And everyone says, oh, do a Kegel and everything will be better. Well, sometimes I tell people, and more often than not, you actually need to let go of your pelvic floor muscles. It's like you have TMJ down there and you're too tense. And again, this can be part of that stress response, the trauma responses we're going to talk about here in a minute. So with the pelvic floor muscles, you have 4 to 5 basic functions. People will say different things, but the first is support. So it supports your organs. It literally makes up this hammock. Think of a hammock, envision a hammock in your pelvic region that supports your organs and manages pressure. And then the second is sphincteric control. So if you don't want to urinate, if you don't want to be sexually active, if you don't want to pass gas, we can tighten up, and the pelvic floor muscles tighten up and keep those things from happening, or we can completely relax, and then it allows us to urinate, to have a bowel movement, to pass gas, etc. So that's sphincteric function. The sexual function is there's one main muscle in the pelvic floor that goes into a rhythmic contraction when we have an orgasm. Same in men and women, and it is the pleasurable part of an orgasm. So far we've got support, sphincteric function, sexual function, and the next function is stability. So the pelvic floor muscles, when we tighten them, also work with, and there's more than muscles than this, but we'll just say a muscle, the transverse abdominis muscle, and then the multifidi in the spine. So if you are someone who wants to go do a plank as an exercise, or you're lifting weights, or you're just getting groceries out of the car, what have you, those muscles all work together to give you that core stability. And then the last function, sometimes people don't talk about this, but pelvic floor and the diaphragm muscle move together. So when we breathe in, pelvic muscles tend to go down. When we breathe out, they come up and contract. And so in general, now we can get more specifics, but this is a high 30,000 foot view.
When we look at it in the terms of the diaphragm maybe being that 5th major muscle group, then we start to think about the organs that are inside between the diaphragm and the pelvic floor itself. That's intestines, sexual organs,
Your stomach,
your stomach even is
liver.
in there. Yeah, all of that. So we can see how all the different organs actually do work together. We actually cannot separate our organ systems from one another for sure. So headed back then toward what we were talking about, you had touched on this idea of bowel issues being related to sexual trauma. We can start to see how actually they're not separate in that way either, that they certainly can work together. We might typically think of pelvic floor issues as being maybe trouble holding urine or having painful intercourse. But we can see how, well, maybe any of the organs in there can be impacted by pelvic floor dysfunction.
Yeah, and you know how, going back to when you talked, if we're ready to talk about this, the chi stagnation or chi being blocked were certain trauma responses. So there, coming from my viewpoint, a couple systems, the autonomic nervous system, fight or flight, people hear about that all the time. And then the other one, the parasympathetic nervous system, we call the rest, digest, have sex system. And each of those release different chemicals. So when we're in the sympathetic nervous system, fight or flight, we're releasing adrenaline and cortisol. And one of the main things as a pelvic PT that I look at is that creates an overall muscle tension. You're going to see TMJ, You're going to see people sort of clenching their fists, clenching their jaw, sucking in their stomach, sucking up their pelvic floor, and not really even knowing they're doing it. That's just one thing. When we release those chemicals, we also see slow digestion. So then we see more constipation. When you're in a fight or flight response, your bladder specifically for pelvic health, it is not the time, I tell people, it's not the time to pee, poop, or procreate, even if you're not trying to have a baby. Right? You are in fight or flight. Your body thinks you need to run, you need to fight. Maybe you even shut down and freeze. Some people faint. And so,
fight or freeze, right? And they all do release, even if you're freezing, which
yes,
is another one of those major stress responses in an acute state. And then it can turn into a chronic state.
yes,
Still does stress the same adrenal, cortisol, hormonal balance.
axis.
Yeah.
Yes. And so you're saying you have the chi stagnation. Is that what we want to call it? There's a blockage of chi. And I'm looking more.
Medicine, it's interesting we brought up the liver because the liver courses the body's chi or energy through the body through meridians. So when we have extreme stress or even chronic low-grade stress, or we have unfulfilled desire, our needs are not being met, that causes the chi to become stuck. And then that has a whole host of ramifications. But that's how it ties in here when we're talking about trauma, is that now, the body's not getting what it needs. It's not being honored. And so then that chi or that energy literally becomes stuck.
Absolutely. And so on the flip side, I think in both of our practices, we're wanting more of the parasympathetic nervous system. For me, that's what I would call it. And again, like we said, a lot of people know it as the rest, digest, have sex system. And I named it the pee, poop, procreate, play, partnership, and peace system because it's all the P's.
P's, I think. Yes.
And again, in my perspective from pelvic health, I'm going to see that muscle tension release throughout the entire body. I'm going to see that digestion system start working better. I see the bladder functioning the way it's supposed to. And going into, the sexual health is if we are more relaxed, especially for women. So this is when the sex counseling comes in. That is actually, I was going to say women tend to have more of a responsive desire. That's a little bit of me putting people in a box. So please don't come at me on that one. Men tend to have more of a spontaneous desire. If women specifically, and you tell me what you see in your practice, but if women are thinking about the kid's schedule and that the dog needs to be fed and they need to get groceries and there's drop off and they have carpool and this and that and laundry, etc., their system is not in that parasympathetic system. It's not in that relaxed state. It is in the upregulated fight or flight response. And so then we start seeing sexual desire issues, sexual physical arousal issues. Then you can go into having difficulty with orgasm. Then we go into maybe it starts affecting their relationship with their spouse. So, and affecting the family unit, etc. And so there's so many ramifications of what we see from an imbalanced system. And I say to people, I see it at the end of things because it sort of does start coming out in that pelvic health region, right? Bladder, bowel, sexual health.
I love talking with you. And every time I talk with you about this, I learn something new and I start to think about my own client base a little differently. And it's what I love about collaboration in general and about integrating care because I still get to learn. And then that helps me help my clients better. And for me, when a woman comes and one of her complaints is that she has a low libido, I often think about, well, what's going on at the root of that? Usually it's fatigue. Like we're really, really tired. Maybe we have been in fight, flight, or freeze, that bear's chasing us feeling for a really long period of time, or we're burning the candle at both ends, work, family, cleaning, and just normal, like, caring for other people in our lives and not learning how to care for ourselves. That causes like a deep level burnout. But what I'm hearing you say that's hitting me a little differently is that, and I'm going to actually ask you to repeat it because it's that important, that it's not just burnout from life itself that can cause this. You said that men tend to be more spontaneous and women tend to be more
responsive desire.
Right. So where can that get lost for women? Because that's an important piece right there.
So again, there is that burnout factor, right? The adrenals are on overload. We're getting just constantly bombarded with that adrenaline and that cortisol, which over time just completely fatigues us out. And to have that desire to be able to, let's say, be sitting with your partner and watching them play with the kids, or maybe you're outside in the garage and your partner is working on something. They're mechanical and they're working on an engine and they're all sweaty and they're a little greasy, and the woman is in the calm state of looking at that and appreciating that partner and thinking, wow, that really turns me on. He's got a little, he's got that glisten because he's sweating, and I really enjoy that, or I love how he plays with the kids, or what have you. You're in a nice calm, I don't want to use the word calm, but more in that parasympathetic relaxed state to be able to notice that. When we're running around and busy and we can barely breathe and have 2 seconds to ourselves as women, there's no time to be in that state of mind. And so that desire that it can be more responsive. Let's say even if maybe your spouse comes up behind you, you're doing dishes and puts you in a bear hug, and they're thinking, hey, I'm ready. And you're like, oh my gosh, I've got the dishes. I have to wipe down the countertops. I'm cleaning up this. There's no room for that responsive desire. And so with libido, we want to be looking at so many things, right? That integrative, multidisciplinary approach. Maybe it's hormonal. Maybe there is something else going on. What is going on with their chi? What is going on with relationships? Do they have any time for themselves? So did that make sense?
It does. It makes a lot of sense. And I'm thinking about the parasympathetic nervous system and the sympathetic nervous system. And the term I learned from heart math biofeedback is incoherence. So when the sympathetic, the fight or flight freeze, and the parasympathetic, the 6Ps, and the digest, are working together to sort of balance one another. In Chinese medicine, we would talk about that as yin and yang. We're never really want just yin or just yang. We want a nice, healthy balance between the two. So there are a lot of tools then that we can, when we understand that dynamic, we can employ those tools to help us in all areas of our health. And, obviously pelvic health is one of them. What are your passions and what are some specific tools that you're able to give people who have experienced sexual trauma? I can tell you with my VA patient base that the sexual trauma for them is just literally off the charts. It's actually shocking to me still, the amount of sexual trauma that a lot of the veterans have experienced. What kind of tools are you utilizing with these patients these days?
So, oh my gosh, can I just say I'll just throw it out there, being a patient of yours myself, right? So professionally and personally, I know you. And coming into a quiet space, coming into a space where the lights are dimmed. I am lucky enough to have a room where I have a window. So I will ask the veteran, can I dim the lights or turn the lights off since I have a window? So dim lights, calm setting, trauma-informed approach is really important. Especially in the veteran setting, but for most people who are survivors of any type of trauma, I make sure that their back is not to the door. I make sure that they are seated in a place where they can get to the door easily. I do not position myself between them. I really sit down and create a rapport, a healing space, and then develop that rapport. Now, in terms of specific tools, of course, we talked about the diaphragm, and we know that breathing calms that system and can help. Now, if we want to think, let's just think muscle tension in the pelvic floor. So if someone's in muscle tension, so I say they're on lockdown, they're keggled to the moon, that is affecting how their bladder empties, what the bladder urges, what's happening with constipation and sexual function. But if we just focus on bowel and bladder, so we want to create a way of getting those muscles to relax. So we absolutely can use breathing techniques. We can use techniques to calm the fight or flight system. I mean, progressive muscle relaxation, hands-on therapy, manual therapy by me that is very intentional and soft and not too much. I always tell them less is more. We can get so much with your body responding, less is more. So we'll do that. Obviously, there can be stretches. There are certain positions to help with that pelvic floor stretching out. There's self-massage that they can do. And of course, then we really, really start working on coordinating contraction and relaxation of the muscle groups and making sure the education component is there, that people understand, women specifically and men, but understand what is happening in that balancing the sympathetic nervous system and the parasympathetic nervous system, because that the education is really, I feel, the biggest key for a tool. And then
It provides so much hope for people, right? Like once you know what's going on and you know that there are things that you can do, it's so empowering for all of us to know that we actually do have things that we can do to help ourselves. We don't necessarily need the medications, to numb us out.
right, that's absolutely true. Can I just briefly talk about the statistic with trauma, sexual trauma? So in the United States, for women, it's 1 in 4 women. I believe they're saying it's 1 in 8. I might have to check that in men. Globally, for women, it's 1 in 3. In the veteran population for women, it's 1 in 3. And then 1 in 50 for men reporting in the veteran population. It's a very big deal. Now, we can also have other types of trauma. Of course, women who are having babies, right? So birthing traumas, you could have a C-section. That's a trauma. Surgeries are traumas. I have people that were mechanics on airplanes who fell off the wing of an F-15 fighter jet and landed on their tailbone. Breaking their tailbone is a trauma. Right. So car accidents are traumas. So many things can happen. So there can be traumas in that way too, that there's actual physical trauma. Surgeries, maybe someone's going in for a hysterectomy. Maybe someone is having surgery for prostate cancer and having prostatectomy. So cancers can be traumas.
Thinking of an infection, and I'm also thinking of, verbal, like emotional trauma, just being spoken to in a way that's traumatic.
Absolutely. Emotional trauma is huge, right? Because it, again, sends us into that fight or flight. Everything tightens up and all of our systems are affected.
Where are you headed in your career now? It's been 25 years and, I can speak for myself that I'm ready to shake things up a little bit. That's where Mother Nature's doctor came from. I'm ready to sort of spread my wings and just with my level of expertise be able to share. I love working with my clients one-on-one. It's still the highlight of my week. I just am ready to share more widely. And I'm curious, what are you doing professionally in that way?
Yes, I agree. And it's your experience, right? And the expertise. Experience and expertise is the key. And I am in the same stage of my career. Doing this for 25 years, I really feel like the next steps to be able to reach more people, more patients, if you want to say it that way, more people with pelvic health issues and have a greater impact is I'm really starting to focus on educating and training the new generation of pelvic health professionals, whether that's a pelvic health PT, physical therapist, physio, occupational therapist, a mental health professional, sex counselors, sex therapists, because I come from this space in such a unique area that I do pelvic health and I'm allowed to touch my patients. I can do internal pelvic exams, et cetera, over all these years, and then tying in the trauma-informed care with it as well, I think. So training other people is really where I want to go. I do believe that will have the largest impact on improving care for women.
Appreciate that because as you just mentioned, the statistics are far and wide and the amount of impact you can have on educating all of us on how to help our clients and where to direct clients as well is just immeasurably valuable. So thank you for all your work. I'm so grateful. Do you have any closing thoughts?
If you're having pelvic health issues, which remember can be shameful just in themselves with bowel and bladder sexual health issues, and you've had any type of trauma, which can be shameful, I want you to know you are not alone. There are so many people that have been in this situation. Many people have healed, and there are a lot of us professionals out here who know what to do and can help. And then obviously with Mother Nature's doctor and Dr. April doing more of her education and then me providing more education, there's more of us able to help you. So that's the biggest thing is you really are not alone. And that is the takeaway.
I appreciate that, Amy. I'll tell you, I never heard that translation before today about the pudendal nerve and shame. And I fact checked you right away. And indeed, you're correct. That is so true. And shame is an interesting emotion. And yet it's one that is certainly real and it certainly deserves to be acknowledged. And to know that we can work through shame and our belief systems that we develop from shame and really transform our health emotionally, physically, sexually, spiritually, and in all the ways. Absolutely. So much. I appreciate you coming on Mother Nature's Doctor podcast and would like everyone to know that you can reach Amy at pelvichealthpt.com, where you can explore that website and be directed in a very specific way, whether you are a patient yourself looking for help or, as Amy mentioned, a healthcare practitioner in lots of different ways. Pelvic health PT and counselors. And who else did you mention again?
We can have pelvic health PTs, OTs, mental health professionals, acupuncturists who are looking to get into more of the women's health, pelvic health realm as well. Definitely.
Fantastic. Well, thank you again. We'll look forward to doing this again.
Yes. Thank you, Dr. April. Thank you so much for having me.
Okay. Thank you to everyone. Bye-bye.